Today, we have the pleasure to have Dr. Jaime McBride and Dr. Michael Bush-Arnold and talk about support system in medicine. Dr. Jaime McBride is an emergency medicine physician in the Northwest Ohio area. She works in emergency rooms across the Northwest Ohio and Southwest Michigan. She completed her Bachelor of Science in Community Health and Kinesiology degree from the University of Illinois at Urbana-Champaign. She graduated from Ohio University Heritage College of Osteopathic Medicine and completed her residence from Henry Ford Wyandotte in emergency medicine. Dr. McBride was born and raised in Chicago, Illinois, in the Hyde Park neighborhood. She enjoys riding her bike, traveling, and spending time with her family. She's married to Dr. Michael Bush-Arnold, who is sitting next to her, and they are the proud parents of 2-year-old Harper Cecilia. Dr. Michael Bush-Arnold is a physical medicine and rehabilitation doctor, physiatrist, with the Rehabilitation Institute of Michigan in Detroit, where he served as a medical director of the Spinal Cord Injury Unit. He completed a Bachelor of Science in Kinesiology and Health from Miami University in Oxford, Ohio. He graduated from the University of Toledo College of Medicine and Life Science and completed his residence from Emory University in Physical Medicine and Rehabilitation. He subsequently completed a fellowship in spinal cord injury from the University of Michigan. Dr. Bush-Arnold was born and raised in Toledo, Ohio. He is an avid Buckeyes football fan, enjoying watching movies and love being with his family. He's married to Dr. Jaime McBride, and they are proud parents of 2-year-old Harper Cecilia. Thank you both for being here and share with us your experience. Thank you.
Thank you.
Thank you for the warm introduction, Dr. Wishner. So we'll go ahead and get started. I'll put this, is everybody seeing a very large screen, James? You think that?
Yeah, it looks great.
Okay, perfect. Okay. So like Dr. Wishner said, I'm Dr. Jaime McBride. I'm an emergency medicine physician in Ohio.
And I'm Dr. Michael Bush-Arnold. I'm a physical medicine and rehab specialist in Detroit, Michigan.
So throughout the PowerPoint, we'll give an agenda of what we'll be talking about. And this is more so a conversation where we like to have time at the end to talk to some of the participants. And so we want to talk about having a strong support system in medicine and what that means to us specifically, and really our personal journey and personal experience with our journeys in medicine. So before we start, we'd like to share our own personal favorite quotes. I know everybody probably has their own, but I'll let Michael go first in sharing his.
So one thing I've heard since pretty much I was born was get up before you fall. And that's something that my grandmother used to always say. It never really made much sense to me growing up as a child, but as an adult, I've learned that it means that before things get really bad, that you have to learn to overcome any adversity and actually press through before the adversity takes the best of you. So to me, that's what get up before you fall means. And it always reminds me of my late grandmother, Frenchie Lathan.
And then a quote I like to share that I always carry along with me, and oftentimes I'll share with the residents before I present, is a quote by Maya Angelou. And it's just saying that I've learned that people will forget what you said, people will forget what you did, but people will never forget how you made them feel. And so I always carry that with me. Even in my personal relationships and my patient interactions, is that, you know, no matter what you do, you always want to make people feel welcome, make people feel loved, and always promote a sense of kindness to others. So that's what we want to share throughout this PowerPoint.
So what we'll be talking about today is a little bit about our story, how we met, a little bit about our how we got to where we are in medicine. We're going to talk a little bit about burnout in medicine, give a couple short experiences about burnout in medicine, and then more importantly, how do we get past that and what support systems in medicine. And then hopefully we'll have time for questions and answers.
So
would you like to start?
I'll start.
All right.
Okay. So really, where it all began was in Toledo, Ohio at Mercy, in the Mercy Health System at St. Vincent Medical Center. I was a third year in medical school while Michael was, in his fourth year.
You're doing an elective rotation.
Exactly. And so we were both in the emergency room. Michael was very disinterested in his emergency medicine rotation. I'm sure some of the medical students can relate, but I was very excited and ready to show them, all that I had to offer to be a part of the EM community. So we met, we had a Code Blue come in. And so I was pretty much the first one to go in and see the patient. And Michael, on the other hand, kind of stayed back in the background. And I started on chest compressions for the patient. And I feel this tap on my shoulder and I turn around and it's my future husband. I didn't think about it that way, but there was Dr. Bush-Arnold, and medical student doctor, I should say. And he asked if I needed any help. And I was always a person to get it done myself, even though you are supposed to have help during any type of chest compressions. I wanted to show them that I could do it by myself. So I proceeded with the CPR along with the other team, because as medical students, we participate in doing those chest compressions. And eventually, I soon became very fatigued and tired, and I looked over and I said, okay, can you help me now?
For all the married people in the audience, as you know, there's two sides to every story, and then, well, three sides to every story, her side, my side, and then the truth. So that's not quite how the story goes. I tapped her on her shoulder as you're supposed to do after 30 or so seconds, and she wanted to keep going. I then tapped her again on the shoulder one more time. She wanted to keep going. For a third time, I tried to tap her on the shoulder. She wanted to keep going, so I stepped back as she wanted to keep going. Then you can continue, my love.
Okay. So eventually, we, the patient, we could not resuscitate. And so we left the room soon after that. And we never heard from each other after that. We never saw each other again in the emergency room. But long story short, we eventually, the magic of social media, we contacted each other through Facebook and eventually went on our first date, and really the rest is history from there. We'll talk a little bit about, so Michael essentially, since he was in his fourth year, had already really matched.
I can tell my story.
Oh, sorry.
So when we had met each other, I already knew that I was doing physical medicine and rehab. Again, I was in my fourth year of medical school. Had already applied to programs and was just waiting to match. So we met in December and we started dating. Dates aren't that important, but April-ish of the following year. So I had already matched by that point. I knew that I would spend my intern year in Toledo, Ohio, and do my categorical year in physical medicine rehab at Atlanta at Emory University. And Jamie at that time still didn't know where she was going to be. She was going to her fourth year of medical school. So we dated 1 year while we were in Toledo, and then Jamie matched into emergency medicine
at Wyandotte, Michigan. And essentially we spent the last 3 years.
3 years long distance.
So Actually, we'll talk more about those challenges, about, the stress that comes along with having, not only being in medicine, but I think if you're in a long distance relationship, what type of support that's needed. And we'll talk a little bit about that.
Needless to say, we became good friends with the airport and with Southwest
And
Airlines.
Southwest Airlines, right?
Sometimes Delta.
So we were married June 30th of 2018, and then soon after we had our first child, and she's 2 years old now. Her name is Harper Cecilia.
And that was an experience in itself, because in that time period, I graduated from residency. I moved to Woodhaven at the time to be with my fiance. 7 days later, got married. 10 months later, had a baby, and I started a new job at the time period. And right at the end of around Harper's birthday, Jamie finished her residency.
Right. So lots of life events that added stress to our lives, and so we really depended on each other and our family circle and our friend circle to really help support us through those challenging times. So we'll talk a little bit first about burnout, because I know we talked about our journey to get to this point of how we met, and we started new jobs and had a baby, and life-changing events that ultimately can, really affect burnout, because really burnout can happen in any field, but more specifically, we know that physician burnout burnout is more prevalent in physicians. So we'll talk more about that. So when I think about, I read a recent article on a recent website by a family medicine physician, and the article was mainly about what was burnout and how do we think about burnout. And so oftentimes I'll say to myself, my batteries are just run down. And really, what does that really mean? And is that the right way to really think about it in the field of medicine? And so this article stated that really the idea of burnout is a disorder of energy metabolism. So there's a common metaphor, which I talked about, which is, burnout is the battery. But really, once a battery stops working, what happens? Things don't work anymore. So in medicine, I try to change my perspective about thinking about burnout. It's not really that my batteries are run down, but a more accurate and useful metaphor is an energy account. So really pouring into different accounts to aid in my balance of positive energy instead of negative energy. So we'll talk more about that on the next slide. So I want you to think about throughout the PowerPoint after our presentation, is your energy account full or is it empty? And what are some things that you can do? And we'll give you some ways that you can aid in preventing burnout, or ways to even help you if you are feeling burnt out at that time. So just keep that in mind. So really, burnout is a constellation of symptoms occurring, like I said, when your energy account has a negative balance over time, almost like a bank account.
Almost like student loan debt.
Almost like student loan debt, right? So we'll talk more about that. So there are 3 types of energy accounts I want you to keep in mind. And although we have the, official burnout, definition, which has been defined by WHO which is the World Health Organization, as a syndrome of chronic stress over time that can lead to what we know as exhaustion, depersonalization, and lack of efficacy, which are commonly known. But I want you to think about burnout as, instead of those three things, but as in physical, emotional, or spiritual accounts or energy accounts. So really, you can't give what you don't have. So we'll talk more about that, especially, during our own journey of how we've overcome things and how we're still practicing to, to prevent those things from happening where we have those negative balances in those accounts. And then something else I want you to just keep in mind is that your best work and your best life depend on your ability to manage all three levels. So your physical, emotional, and spiritual energy accounts.
So we talk a lot, my wife was talking a lot about energy accounts and burnout. But the 5 main things that show up throughout time with both physicians and in general practice and with the general population, but more specifically with physicians, are 5 main causes of burnout. So there are the practice of clinical medicine. What exactly does that mean? Being a physician, and as most of you know, being a medical student, it's a very difficult job. Everyone's not cut out to be that. So just the general idea of being a physician who has the responsibility of someone else's life in your hand can be a very burdensome task. It's an awesome task, but it can be a burdensome task at the same time. So just the whole idea of being a doctor, knowing that all these people are responsible for you, knowing that you have lives in your hands, can be one of the causative factors of burnout. Also, it's very important to know to do what you love. And in medical school, it's a little bit hard to figure that out. You're in school, you have 2 years of book work, and then you're spending a couple weeks in multiple rotations, and it's very hard to know what you want to do with the rest of your life. It's not like you can just decide, hey, I'm going to be a pediatrician, and then up tomorrow I want to be an anesthesiologist. It's very difficult to switch to different things, especially once you finish residency and establishing your job. So finding something that you love is very important to do. And as a medical student, that can be a daunting task, trying to figure out what that thing is that you want to do for the rest of your life. The other thing is just having a life. Just because we're in medicine, the rest of the world doesn't stop. As my wife was saying, we have marriages, we have children, we have the stresses of paying bills, stresses of seeing family, trying to get to different events, making time to have with our friends. All those things, if not done in balance, can help lead to burnout as well. And then conditioning of our own medical education. What that means is that our jobs and our training teaches us that we have to be perfect. Can't make a mistake. Everything has to be just right. And unfortunately, everything is not always just right. And oftentimes we're not given the tools to help navigate what to do when everything is not exactly right. So that also could be a causative factor that leads to burnout.
And then I also just to piggyback off of Dr. Bush-Arnold, is that, I was often taught, during my clerkship years that, I've not taught, but thought that I had to be a perfectionist or a workaholic, or that, the patient always comes first. And so, and then also to just never show my weaknesses, if I was tired or stressed, to just say that I was okay. And really, that's not okay to do that. And so I think it's the practice of recognizing that, we don't have to be perfectionists. We don't have to be workaholics. And it's okay to put ourselves first. So I think that's important to know.
One thing that you definitely, in most cases, do not have control over is who your immediate supervisors are. But it's been shown in the literature that the leadership skills of your immediate supervisors can be a cause of burnout. One of the number one reasons most people leave their jobs is not because they hate their job. It's not because of pay or location. You kind of know all those things when you're signing up for a job, but it's because of the leadership skills of their physician, if they of their supervisor. If their supervisor is not understanding, not accommodating, doesn't take their input, doesn't incorporate what they're saying, physicians are a lot more apt to leave than to stay in that current practice environment.
So, there's lots of reasons that could cause, burnout, but these are the 5 things that I think we should keep in mind, especially geared towards student doctors and residents, physicians that are going into practicing medicine or practicing medicine currently.
And we say, and this talk is about physician burnout, but these things are very applicable to medical school and your time as a resident physician as well.
So really, how can we stop physician burnout? Well, I think it's, in the last few years, there's been a lot of promotion about, wellness, especially in the medical community, especially among medical students and residencies. I know I work a lot with the UT emergency medicine residents, and wellness is something that is important, and they incorporate it. So I think when we think about how can we intervene, we know that there's some things that we need to do. And one of the most important things is to lower your stress levels and the drain that they produce. And there are some ways that we all can lower our stress levels. Although our tasks may be stressful, we're going to give you some ways that not only that we practice to prevent burnout from happening, but some things that you already may do. And then also to improve your ability to recharge your energy account. Like I said, no one is perfect. You don't have to be perfect. You don't have to be the perfect medical student. You don't have to be the perfect resident. We're all human. And so I want you to give yourself time to be able to recharge, either, pouring into your physical account when exercising and meditating, or, your emotional account, which is, speaking to family or friends, or maybe even a therapist. And then spiritual account, really recognizing or thinking about why you really went into this, why you went into medicine, why is this important? So using that to reflect, whether that be going to church or just meditating, but really honing in on why you are still doing this, why you want to still do medicine. So I think that's important, and I think that's what we do often. And so it's kind of checking in with yourself, letting yourself know that you may not be okay, but how do you reach down into inside yourself? Because we all have those things to realize that this is important and this is what you want to do. So how can you recognize when you are burning out? So I put this quote in the presentation because I feel like I say this from time to time to Michael when I'm just being dramatic, but it is a reality. Sometimes you feel overwhelmed. I get overwhelmed. Sometimes you feel like, even being a newer attending physician, I express like, maybe, I'm not sure of how much longer I can really go on like this, feeling depleted, feeling like my energy accounts are down. So it's something to think about, and really, like I said, really focusing on recognizing that this, that this is a thing, that it's okay to feel like this. But what are some ways we can intervene to recognize it?
So we talked a lot about burnout, and the reason why it's so important is because these are the results of what can happen. Physician well-being definitely is impacted. That's what we've been talking about this whole time. But that leads to other things. That leads to suboptimal patient care. And that also leads to, when this goes on as a collective group, leads to poor healthcare, to a poor healthcare system in general. And we're talking about well-being, we're talking about physician burnout, and those are all very important things. But when you really think about it, and the reason why there's such a big push to help correct this and help fix this is because the bottom line comes down to dollars. I hate to say it, but it does. When there's physician burnout and when the physician leaves, a hospital group, a hospital organization loses upwards to almost, depending on the specialty, but upwards to $1 million. Also, if there's increased medical errors, if there's reduced quality of care, reimbursement rates go down. And that's totally aside from the whole human piece of patients are suffering, physicians are suffering. So physician burnout's not good for anyone. It's not good for you. It's not good for me. It's not good for hospitals, and it's definitely not good for patients. So we need to keep in mind what are some of the things that are going on that can impact our physical being, that can impact our spiritual being, that can impact our emotional being. Because if we're more mindful of what those things are, we have better ways to kind of combat them and to reduce those things so that we can be the optimal physicians that we've been trained to be. So for all you who are undecided on what specialty that you want to go into, this is a list of the most burned out physicians by specialty. So as you can see, up top is urology. At the bottom is public health. Again, just because these are the statistics, this does not mean that you're going to be burnt out, that you're not going to have a long, enjoyable career if you're a urologist. But there's certain things that you just need to take consideration of and make sure that you have the support strategies, which we'll talk about a little bit later, in place. So as you can see, where my wife and I are somewhere in the middle.
Neck and neck. We're neck and neck.
And this data is, I think, from 2018, but the most recent data shows that emergency medicine is high up on the list, and I'm sure most of you can guess why. COVID. That's impacted medicine tremendously, and not just for emergency medicine, but for myself as well. The whole landscape of medicine has shifted because of COVID. You have nursing shortages, you have just staff in general shortages, and that affects how many patients you see. That affects the quality of care. Then that affects reimbursements. That affects if patients can be admitted to hospitals. Are they being discharged prematurely? Affects all those things. So just be mindful of which physicians have the highest burnout rate. And if you want to do something, just to know that you need to have specifically, regardless of the specialty, but the higher ones, that you need to have support systems in place to kind of combat that.
And don't let this discourage you. I know
Not at all.
I've looked at this several times, and I know that a lot of my colleagues, although it's not expressed, that we are experiencing at least one of the three cardinal symptoms of burnout. So, I don't want anybody to be discouraged in looking at this chart, but I think it's important to mention it because, it's a reality.
And it's okay to feel one of those ways, but the important thing is to moving from experiencing it to ways of moving past it. So which generation is the most burnt out? That would be Generation X. So we use the term millennials, Generation X, baby boomers all the time, but what exactly does that mean? So for the purposes of the study, what it meant is that millennials are from the age of 25 to 40. So we're millennials. I assume most of you watching this are millennials as well. Generation X is from 40 to 54, and then baby boomers are from 55 up to 73 in this study. But it's interesting to know that Generation X has the highest rate of burnout, but also makes the most sense because when you think about it, Generation X is in the middle of their career. Most likely they have a young budding family, and at the same time they have parents who are aging and getting older as well. So they're right in the middle of life where they're experiencing both all the struggles and the difficulties with the beginning of life with their own family, but yet at the same time experiencing the end of life with their parents and grandparents as well. So the study also found, and what the study was, it was the survey of a number of the physicians from across the country, all different landscapes. But what the study found is that women are more burnt out than men. And there's no hard and fast reason why, but one of the things, and my wife will speak to her own experiences, but one of the things is that traditionally women hold the brunt of managing a household, and also if having children have the responsibility, the awesome responsibility of carrying a child. So when you pair that with working a stressful, high demand job, that can lead to burnout. My love.
I agree. I can see why 48% of women are feeling more burned out than men. Just, I think I'm learning more so to delegate my tasks, but initially, having like a new family and being, in the role of being a wife and also having a two-physician household, it can get complicated. And so, being an emergency physician, my schedule is pretty much, I go from mornings, then I can often go to afternoons, then I work overnight. But Michael has a very set schedule, 8 to 4, Monday through Friday schedule that I sometimes envy. But, there's a lot of things that I feel like, or I have felt, because I'm still practicing on still delegating things, but to give up some of those tasks, whether it be cooking, cleaning, finding easier ways on how to manage that. And I know we've even had friends and family to encourage us to do those things, and it's not until you actually hear it from someone else is that you don't see the issue, right? And you don't see how it's affecting or having any influence on how you're feeling, because really, taking it, doing it all, I should say, can really deplete me. And also, like I said, deplete those energy accounts. And so I want to make sure that, I'm in the positive and not in the negative, right? So really learning how to delegate those tasks, because I have a type A personality. Dr. Bush-Arnold will tell you that, I like things done a certain way, but I have to just let go, because that, even though it can't be done my way, it could just be done, and the task can be completed.
So has burnout had an impact on your relationship? Pretty much every generation, yes. And again, more so on millennials, because we're we're at the beginning part of our career. Most of us are at the beginning parts of establishing families, the beginning parts of marriages. beginning parts of extended relationships. So yes, it can impact our relationships. Has it affected ours, Boo?
Yes, it has in some ways.
But the important part is making sure that you work through it so that it doesn't become a lifelong issue and that you prematurely end a rewarding career. So we want to get to some of the solutions. So we're going to speed up a little bit, but this is how some of physicians get through burnout. As you can see, exercise and sleep are common among all of them, and usually, but it varies between generations. How do physicians cope with burnout? These are some of the ways. Isolation from others probably is not one of the best ways, but it's one of the ways that a lot of us use. Also, binge eating, drinking alcohol, prescription drugs, marijuana, probably not the best either, but that's just a reality of what some people do to cope to get by. And hopefully we can provide you with some strategies that are better than those that some physicians are doing. Where are physicians most burned out in healthcare organizations? I can understand that. I can speak to that very well. Being in a large healthcare organization, there's a lot of bureaucratic things that go on that can become very that can make you despondent about your job, but you have to remember why you did it in the first place, and employ some of the techniques that we're going to talk about coming up of how to get through it. One of the things that we did want to mention is that according to this article in JAMA, that most of the burnout occurs in the least amount of burnout, I should say, occurs in minority populations. Now there's a debate on to why and if this is necessarily true. If you look at the data behind it, the sample size for both Black physicians and Hispanic physicians and Asian physicians were quite low, so that can kind of confound the data a little bit. But what the article does say is that more of, especially Black and Hispanic physicians, go into primary specialties that they feel are more rewarding and that can benefit their community more. So that's one of the reasons why the study cites that there's lower rates of burnout and also higher rates of work-life satisfaction.
So really the article just really just states that, you know, more studies like this need to be done as a measure of physician wellness as it relates to race and ethnicity.
Because at the end of the day, we're all physicians, and no matter the race, no matter the sex, no matter the gender, we all need to have the best wellness for ourselves so we can provide the most optimal care for our patients. So here are some of the strategies that we have to prioritize our wellness and to reduce physician burnout. One of the things I want to say is that in all of the literature about physician burnout, there's two main ways of addressing physician burnout. There are individual focused programs, and then there's organizational focused programs. My wonderful wife and I, neither can any of you singularly change organizational focused programs, but what we can do and what we're trying to give you coping skills with are how to address the individual focused programs.
So really some things that we mentioned earlier about, you know, the 5 main causes, but really when you think about, you know, what specialty you want to choose, where you want to practice, are things that can help, you know, take away some of that stress. You know, being a physician is and has always been a stressful job. So, you know, I think, you know, choosing those, you know, having those 2 things to choose really can help you live a balanced life. like I mentioned earlier in previous slides, to delegate work appropriately, and this can be in your personal life or when you're in your clerkships or as a resident or as an attending physician. I think it's a practice that you just have to keep on doing because not everybody is great at delegating tasks appropriately.
And sometimes it's okay to say no. That's a very important thing to learn in life. So a quick story that I have is that there's a resident that I have who at the time I didn't know, but he's working on several different projects. He has, I think, 4 or 5 different research projects that he's currently working on, and I asked him to write a case report, and he gladly said yes, but I kind of would have preferred him to say no, because I want him to give all that he can to the case report that we're working on, and not necessarily stretch himself so thin that he's barely getting all the things done.
So another important program is, just to pay attention to yourself. So really pouring into either your physical account, whether that is, exercising, or maybe it's getting a haircut or hanging with friends or, traveling, whatever that is. I want you to
binge watching Netflix.
Whatever that is. Also, some things that they don't really teach during medical school is stress management and resiliency. I think, I've learned a few ways to be resilient and manage my stress over time, but it's a learning process. Some things, like I said, how do I, relieve some stress? Exercise or meditate or, going to church. So those are some of the personal things that I do. And then also, positive coping strategies. Those are things that, don't just happen overnight. Those are things that you have to practice to do.
And 2 things I want to mention about all these things. Number one, you have to know yourself. So that means that you have to know what are positive coping strategies for yourself. What are the self-care things that fulfill you, that give you enjoyment? You have to know those things in order to implement those things. Mm-hmm. The second thing that I wanted to say is that, so you have to know yourself, but you also have to just, I kind of said implement it, but you just have to do those things. So just make sure that you know the things and you're able to implement things, and that will help with kind of combat
coping.
How to cope, yes. With
so some of the institutional organizational based programs, which I think some medical schools and also residency programs are really trying to incorporate our restriction in duty hours, how to optimize an electronic medical record, supporting schedules that are more flexible for students and residents, and also attendings as well. And then, how can you, do all your work within, your expected work hours? I think speaks for itself, because you don't want to go home and have to do work at home. And I know that my husband will often do that, and that's challenging because he brings work home, and so that takes away from some of his family time. We balance it, but oftentimes that can be a challenge. And then you want to protect, physician times with patients, and then, promote communities where physicians have, time to, have discussions about how they're feeling and how they're coping and what are some personal, ways to get through and to push through, the journey.
And although as an individual, you can't change these things at the institutional level, it's important to realize these things, because a collective voice can help change these. So if you collectively know as a group, as a residency group, as a medical school, that these are issues, coming up with solutions that can help will be more impactful than just one singular voice. So what does it mean to have a support system? We're going to kind of go quickly through this because we're running short on time, and we do want to give you opportunity to ask questions and to engage with us. But one of our big support systems is our family. They were there with us in the beginning of helping us decide if we want to even pursue a medical career, and were with us throughout the whole time and doing that medical career. So that's one thing that's been very supportive. Even though both of our families are not in medicine, they were very helpful in supporting our dreams and making us realize what's important and just offering that support.
Well, my mom is a nurse, so she was in medicine, but she is in medicine, but she understands some of the difficulties. And then also, friendship support. Me personally, I didn't have a very straightforward way into medicine. I went to a post-baccalaureate program where I met 4 other women who look just like me and are all practicing physicians everywhere across the states. And so they were and still are my, one of my biggest support systems, just as a friend or friendship. And they're more than friends. They're my sisters in medicine. And so without them, challenging me or encouraging me, I don't think I would be where I am today.
And likewise for myself, before I met Jamie, one of my closest friends is Dr. Victor Parker, who's pictured right there. And we just encourage each other to get through medicine. There are times where maybe I express, oh, it's too hard, I want to quit, or this is not exactly what I thought it was going to be, or too much documentation, what have you. But we encourage each other and motivate each other to go on. And you need people like that in your corner to help you get through the long marathon race of medicine.
And then I think we can both speak to this, but we find it most important to keep God first in our lives, and that's really has helped us. Just being mindfulness and having that spirituality, and whether it be during COVID, not so much, but whether we encourage each other or just watching a sermon online has been something that we have tried to do and tried to encourage each other to do as well.
And by no means are we saying that you must go to church in order to reduce physician burnout, but there needs to be some element of mindfulness, spirituality, whatever you want to call it, something that centers yourself, where you're able to look inward and see what is that inside of me that's inspiring me to go on, and what can I use, what can I tap into to help me keep running the race.
And then self-care, we personally, prior to COVID, we like to travel, whether it was within the States or out of the States. You can see our daughter is living her best life, and she knows really what self-care is at the age of 2, but really just, pouring into yourself. We're trying to be avid Peloton riders, but we also like to travel and, go for walks.
I love a good movie.
And we love a good movie. So things are a little bit more difficult during, the era of COVID, but I think finding those things that you can, pour into yourself are good strategies and good coping mechanisms as well to continue to push through. So that concludes, and sorry we had difficulty in the beginning with our PowerPoint, with sharing it, but we hope that our personal journeys really, encouraged everyone to just keep pushing, because we're not perfect. Like I said, we're in a 2-physician household, and we're still learning ways to delegate, to cope, to pour into our energy account, and we hope that you can do the same.
And one more thing I wanted to add is that although we've given you techniques to kind of help just remember that things change. Your interests may change, your partner may change, and that's okay. Just keep re-engaging and keep looking inward to see what are the things that are going to help you get by and what are the things that are going to be helpful for you, because we want you to have long-lasting careers that, more importantly, help uplift the community and promote health for everyone.
Dr. McBride, do you see, we have a question for you in the comments from Grace.
Okay, let's see. Do you have book recommendations for resiliency, etc.?
That's on you.
I personally, no, I do not. Let me see. I think I did have a book, but I can email it to you. I'm blanking on what the book is called right now, so I apologize. So I will email it and send out a list that typically has helped me throughout my residency and just, attending life as well.
One of the things I will say is that, and we didn't really talk about it too much in this talk, but having a partner in medicine is very helpful. And that's actually one of the protective factors from burnout in medicine. So that being said, having a good relationship at home is very helpful. And one of the things that we found helpful as a couple, though it doesn't necessarily specifically address resiliency in medicine, is the 5 love languages. And it's helped us communicate better and have just better harmony at home.
That's true.
Absolutely. Thank you very much for amazing presentation. I love it because so many times you feel that you are exhausting and you don't know why. It's just every day going and going and going, work, home, your daughter, your family, and you just going on and on and on. And I agree, when you have a partner that can speak your same language, it's a little bit easier than when they don't, because sometimes they don't understand what we are going through.
Yeah.
I absolutely love your presentation, how you communicate each other, how you interact each other. I know that they have another question. They were texting me and they weren't able to, in the moment, to write up. I don't know, James, if we can open the microphone for them and they can speak directly and have their question directly to the presenters today.
We
Yes.
have a question from student Dr. Elena.
So the question is, do you have a strategy or have any advice or timing of starting your family in order to avoid burnout affecting your home life? So everyone's a little bit different. But what I will say is, if you can, don't follow our model, being having a child 10 months after getting married. Have that time to be able to learn each other a little bit better, to communicate with each other, to learn each other's communication languages and each other's love languages. And that would be my advice. At least that's my opinion. I don't know what you think.
Well, I think, it's a learning process, right? And so no way is the right way or the best way. But I do think that, we do have time when I'm off and Dr. Bush-Arnold is off, that we have time to ourselves, right? And so that's always been an important strategy or practice for us, because we don't, when we have moments together, we don't talk about medicine, right? So I think that in itself, because, that only aids to the stress, talking about what we do. And so we like to talk about other things. We like to talk about politics or music or, or sports, or different things that we enjoy and we love, because I think when you bring that home, that's a burden that you carry, and we kind of we drop it off at the door. So when I come home,
We
try to, right? So it's a learning process. When I come home and I'm seeing many COVID patients, many sick patients, I take off all my scrubs. I have to, take a shower, and then I'm like, I have to tell myself I'm going to be present, and I am present, because if I'm not, then my husband notices, Harper notices.
2-year-old definitely.
Yeah, she definitely noticed that I'm not fully there. So I think it's a practice that you just have to, start doing now. But it's a never ending practice.
And to better answer your question, there's never going to be a great time. The biggest thing is that you and your partner need to be on the same page of what you want. And if you guys communicate and know what you're getting into, what the challenges are, and what you're going to try to do to get through it, that's the biggest thing. It's never going to be perfect. Even your strategy to get through all the perceived problems is never going to be perfect, but at least you'll be able to communicate at that point of this is what we think we're dealing with, and this is what we think we want to do to get through it.
Any other questions?
Any other question?
And we're
Amazing.
gonna make it known
Which
that
movie did you like to see in your family? Actions and drama, or
the number one movie right currently is Encanto.
Encanto? I love.
Dr. Wishner, I think you're on mute.
Yep.
Yeah, I love it, that movie.
Oh,
Beautiful, and the message is amazing. If you didn't see, guys, everybody who is here participating, I recommend to watch that movie.
and it's really, I mean, it's a spiritual movie. It's about family. It's about love. It's about being kind to one another. It's about bringing people together. And so I think it's an amazing movie.
Yeah.
So.
And then the other movie that our daughter loves is the remake of Annie.
Yes.
So she loves singing Tomorrow.
Oh, and you know what? That encourages us, because now that she knows the lyrics to the words Tomorrow by Annie, we know that, the sun will come out, right? So even when our heads are down and she doesn't know, when she starts singing that to us, not intentionally, just because she loves that song, it gives us some sense of encouragement too.
Amazing. Amazing. I love it. Did you have any question? Any other question that we can ask before we definitely say thank you to Dr. Jaime McBride and to Dr. Michael Bosch? I love your presentation. It's amazing, and like I say, it's something that we do every day, and we don't notice that we are burning out.
Right.
Any other question from the panel?
And we want to let, all of the students know that, we have had someone to encourage us in medicine and be available to answer any questions. So we want to make that known that we too are available by email. And even I think some of the medical students even have our phone numbers. So we want to make sure that, this is a family community, and we really appreciate, Dr. Kim Jenkins and Dr. Wishner for having us today, because this is very important to us, because we had someone do the same for us, to pour into us, to encourage us, to lead by their journey, because even though medicine is stressful, we all have similar journeys, we're all trying to go to the same, place, to the end goal. So we feel that that's important to share.
And one more thing I just wanted to add is that these talks are important, because there was really one serious point in my life where I was thinking, well, medicine's not for me, I'm going to give this up. But listening to a talk like this, I saw that this is doable, and that people just like me have done it before, and hence I can do it as well. So I want to encourage you guys to keep on going on, and when you get in the position, to give back in the same way as well.
Thank you very much. From the Department of Diversity and Inclusion, specific from Dr. Jenkins, she was texting with me. She logged in by the phone, but she was in a meeting and then she is on call. She was unable to be directly here with you, like you see me,
Yes.
but she was in the side
Yes.
with us. We want to say thank you very much. We appreciate you so much, your time, your participation, sharing with your experience is very valuable. Thank you very much. And if you need anything from us too, just let us know.
Yes.
Thank
Thank you,
you.
Dr. Wishner.
And
And
go and enjoy your daughter and say hello from everybody.
yes, and we hope that all the medical students the best, and as they prepare for match, because this is an exciting time. So we
Enjoy it.
right, we just enjoy it, please, because things may not go how you think they should go, but they always work out. Remember that. So we want to encourage everyone that as well. So
Thank you very much, and it was very nice to see
thank
you and
you.
meet you.
Yes.
Thank you, and have a good evening.
Yes,
You
you
as well.
too.